Hi, good morning everyone, and welcome to our Sickle Cell Data Collection Program for California's webinar series. I'm Niani Coker from Tracking California's SCDC program, and I'll be today's moderator. We have a great webinar planned for you today that's focused on integrating nutrition as a management option in sickle cell disease, a call to action. But first, a few housekeeping items. I have muted all conference lines to eliminate background noise, and this session is being recorded. The recording link and slide deck will be made available and automatically sent to everyone that registered for this webinar. We'll take written questions through the chat box or question function on the control panel of this webinar, and we'll hold our question and answer period after the presentation has ended. First, we'll have a few general program activity updates from our CDC partners, and so with that, I will turn it over to Mandeep.
Hi, everyone. I'm happy to provide updates on CDC sickle cell disease activities. Like Nani said, my name is Mandeep. I'm the health communication specialist for the SCDC program here at CDC. Go to next slide. I wanted to start off by sharing about our Steps to Better Health for People with Sickle Cell Toolkit. This is a set of fact sheets geared towards patients, and they're actually based on the American Society of Hematology's clinical guidelines. The first guideline that they came out with was cardiopulmonary and kidney disease. So these first set of materials that are public now, which were released back in April, are based on that first guideline. So we hope that these set of materials help facilitate shared decision-making between patients and providers, and we hope that these materials also empower patients to initiate important conversations with their providers, especially if they have a provider who's not doesn't have as much experience treating sickle cell. So what is available online so far includes these list of fact sheets on the left here, Caring for Common Complications of Sickle Cell, which is a general overview of the messaging. And then we have more specific fact sheets, Steps to Better Heart Health, what to know about blood clots, Steps to Better Lung Health, Steps to Better Kidney Health, 3 tips for safe use of medicine. So like I said, we have a set of fact sheets, and we also have social media resources, including series of images and GIFs, which are great for Facebook, Twitter, and Instagram. And in the coming months, by the end of this year, we'll also have Spanish and French translations available for these materials. And also coming soon is the fact sheet that corresponds to Guideline 2, which is on blood transfusions. So, if you visit this website, we'll have a lot of materials that we'll be adding to the toolkit. And we're hoping that patients really utilize these materials, and then also providers, partners, CBOs, everyone in the sickle cell community. We want these to definitely reach as far and wide as possible. Next slide. And then just wanted to talk about World Sickle Cell Day, which just happened, as you know, June 19th. This year, we wanted to highlight sickle cell summer camps. So we shared a lot of great information on sickle cell summer camps, which many are virtual since last year. As you may know, we shared a lot of contact information about many sickle cell summer camps that are happening. And we definitely wanted to highlight that many kids with chronic conditions do feel a lot of social isolation. So these sickle cell summer camps can be great experiences where kids can engage in fun activities under the direction of healthcare professionals. And we also shared some great stories from sickle cell camp counselors, many of whom attended sickle cell summer camps as kids, so they shared their experiences. So these stories are all available on the CDC sickle cell disease website, which we have a link at the bottom here as well. Next slide. And then wanted to highlight our quarterly newsletter, which is called The Bloodline. We just released our spring issue about a month ago, back in June, I think, actually. So we share a lot of updates on our data, trainings and webinars, about our communications activities. So anything SCDC related, you can find in our Bloodline newsletter, which you can also, if you're not subscribed, can subscribe on the website, which is at the bottom here, and all past issues are available online as well. So that's available. And then I think that those are all of our updates. I think the next slide is, so Mary is usually the one, as you know, who provides the updates. So if you have any questions, her contact information is available here. And I think that's it for me.
Thank you, Mandeep. And now we have just a few updates from our California SCDC program. So I'll turn it over to Susan.
Thank you. Hi, I'm Susan Paul Yukonis with the California Sickle Cell Data Collection Program. And we just have 2 quick updates on things that are going on in the California program. One is a brand new publication out just a couple of weeks ago. And it is open access, so easy to get on PubMed. And it is about the use of our California SCDC data to look at adverse events or adverse effects from the combination of hydroxyurea and iron chelators in Californians with sickle cell disease in our data. So we encourage you to take a look at that publication, and happy to answer any questions about it. That was led by Tricia Wong in Oregon, a healthcare provider there, and then Jackie Baye and I worked on that as well with our data. And then the other is that Cayenne Wellness, which is a community-based organization in California that has done a lot of amazing work with the sickle cell disease community, has an annual educational seminar that they have done in person for many years. And last year and now this year, the seminar is virtual, and so it is open to anyone. It's, you know, you can not be in California to do this. So I would encourage folks to check it out, take a look at it. It's a 3-day long seminar, all done via, I can't remember if it's Zoom or Citrix. And our program will be doing a presentation, but there'll be, I just looked at the agenda yesterday, and there's just an amazing amount of information that's going to be coming out of that. So encouraging folks to take a look at that. And that's it for our updates.
Wonderful. Thanks, Susan. So without further ado, we'll get into the feature presentation. So I'd like to introduce today's speaker, Claudine Matthews. Claudine has worked in the NHS as a qualified dietitian for over 13 years, as a dietetic practice educator and lecturer. She currently works as a health and well-being dietitian in a primary care network. She has expertise in a range of health conditions and has a special interest in personal leadership empowerment, behavior change, dedicating the last 7 years to pioneering the nutrition landscape in sickle cell disease. Claudine has published several articles on the topic and has authored the world's first national nutrition standards for sickle cell, commissioned by the Sickle Cell Society. She was the keynote speaker for the Integral Nutrition in Sickle Cell Conference in London and leading on awareness campaigns in schools in the London area. Claudine holds a master's degree in healthcare education and clinical leadership and is currently in her 5th year of a professional doctorate degree focused on integrating nutrition into sickle cell healthcare provision. And so with that, I will turn it over to you, Claudine.
Thank you so much, Liani, for that introduction. I am so happy and excited to be here. So good morning, California. It is 6 o'clock in the evening in the UK. A bit rainy today, but I'm so pleased that I have the opportunity to share my perspectives on this topic that I'm really passionate about, nutrition in sickle cell. And so I want to start by just telling you a little bit about sort of the topic that I will be speaking about, which is integrating nutrition as a management option in sickle cell, a call to action. And I want to pause there for a moment and just really highlight the last part of the title, a call to action. So we know that knowledge and information without action leads to nothing, but knowledge and information with action leads to transformation and change. And so I want to challenge you as you listen to the presentation this morning that you listen through the lens of a call to action, and that whatever you hear today, that you will use that information to really inspire you and inform you to actually take action following the presentation. The next slide, please. So before I start the main presentation, I just want to tell you a little bit about how I got into sickle cell and nutrition, by starting off with me being brought up in South Africa during the apartheid regime, where I experienced firsthand the effects of oppression and disempowerment. And as a consequence of that, left me with a worldview for social justice, advocacy, and empowerment. And so in 2011, I was introduced to sickle cell disease. I was asked to represent the dietitians in my local hospital on a newly formed sickle cell MDT. And at that point, I knew nothing about sickle cell disease. But a year later, I got the opportunity to apply for a role in a sickle cell service as a social liaison officer, which was meant to be 12 months. And I ended up staying in the sickle cell service for 4 years. In 2014, I was then introduced to nutrition in sickle cell, because up until then, I had no idea that there was any connection between nutrition and sickle cell. And this was me reading an article in our professional magazine about major trauma as an emerging specialty in dietetics. And all the way reading the article, you know, learning about the pathophysiology of major trauma, I was thinking about the major trauma that happens in the blood vessels of sickle cell patients when they're experiencing a crisis. And this left me asking the question, why not sickle cell disease? And so by the end of 2014, I'd written my first article on the subject to raise awareness of nutrition in sickle cell amongst my peers, the dietitians, and then subsequently wrote a few more articles. In 2015, I was so convinced that I had to do something in this area that I actually decided that I wanted to develop a national nutrition strategy for nutrition in sickle cell. And then speaking to one of my mentors, who's a general physician, said to me that in order for me to achieve that, I would have to do a PhD or some sort of doctoral level study. And that's what led me to actually enroll onto the current doctoral program that I'm on, self-funding, because at that point, nobody was interested and nobody was willing to support me with any funding. And so the mission that I have since then has always been to integrate nutrition into sickle cell healthcare provision, because I hear all the beautiful work that is happening, you know, from just what was shared from the CDC, from Susan and from Mandeep. But it saddens me a little bit that nutrition isn't mentioned, but, you know, we have to start somewhere, and hopefully we will be able to action some change, you know, in the coming months. And so this mission is therefore to overcome the challenge of the poor knowledge, awareness, and neglect of nutrition as a management option in sickle cell. The next slide, please. So the presentation will have 3 parts. Part 1 being providing you with an overview of existing scientific literature about the role of nutrition in sickle cell. Part 2 will be considering new research perspectives to understand nutrition as a management option in sickle cell. And part 3 will explore the nutritional implications, problems, and management in sickle cell. The next slide, please. I can't talk about nutrition in sickle cell without first just talking about what sickle cell is. For those people who may have joined who don't actually know about sickle cell, I'm hoping that you all do, but just in case. So what is sickle cell? And I'll give some stats about the UK. It's a complex, lifelong genetic red blood cell disorder. It's one of the fastest growing genetic disorders in the UK. It affects about 15,000 people in the UK, and about 270 babies are born with the condition each year in the UK. So some of the main clinical features: chronic hemolysis, and this is the rapid breakdown of red blood cells, usually between 16 to 21 days, as opposed to a normal person where the red blood cell lives, or the half-life of red blood cells is about 120 days. And this leads to oxidative stress, chronic anemia and fatigue, and chronic inflammation. The second key main clinical feature is vasoocclusion, and this is the blockage of small and large blood vessels with sickle-shaped red blood cells, leading to tissue and organ damage. We also have impaired immune function, and this is due to impaired functioning of the spleen, or some people may have splenectomies, their spleens being removed, and collectively these main clinical features are associated with high levels of morbidity and mortality in the condition. And so in terms of epidemiology, sickle cell mainly affects people from African, Afro-Caribbean, Asian, Middle East, and Mediterranean descent. And according to the World Health Organization, annually, globally, there's an estimated 300,000 babies born with some type of hemoglobinopathy. The next slide, please. So this brings us nicely onto part one, which is looking at the current existing scientific literature about the role of nutrition in sickle cell. The next slide, please. So what we know about sickle cell, we know that sickle cell has both medical implications and nutritional implications, but the current management approach for sickle cell is using a medical model approach, which means that nutrition is overlooked and currently not integrated into sickle cell healthcare provision. The next slide, please. So from the existing literature, we also know that there are a number of nutritional problems associated with sickle cell. And the two key problems highlighted is undernutrition and nutritional deficiencies. But despite the fact that we have over 60 years worth of existing scientific literature looking at the role of nutrition in sickle cell, that has not been translated into meaningful evidence base, and it's not influenced policy and practice development. And for this reason, I have come and taken a new approach to understanding the role of nutrition in sickle cell, and that is drawing on the complexity of sickle cell, also looking at taking a more comprehensive view to the way that we understand nutrition in sickle cell, also factoring in the many influencing socio-ecological factors that affect nutrition in sickle cell. And so the main research problem I've identified is this overwhelming lack of integration of nutrition into sickle cell healthcare provision. And there are 4 publications which I've added in this slide: Prasad 1997, Hyacinth et al. 2010, Khan et al. 2016, and Miyakun and Hebert 2019, explicitly stating that nutrition is not part of sickle cell healthcare provision. And in my opinion, this is because we have this lack of translation of the existing scientific literature into meaningful evidence base. The next slide, please. So the existing scientific literature actually presents a limited perspective to the way that we can understand nutrition in sickle cell. And as I've just mentioned before, undernutrition and nutritional deficiency are the 2 key nutritional problems identified in the literature. But what I'd like to identify with this slide is that we have to start paying attention to the fact that sickle cell is an example of an anemia, a hemolytic anemia, and many of the complications and problems and nutritional problems experienced by sickle cell patients comes directly as a consequence of the anemia, aspect of sickle cell, which actually results in the undernutrition and the nutritional deficiency. And so with this slide, I want to draw attention to the anemia in sickle cell anemia, in addition to saying that in order for us to really get a really clear view and understanding of nutrition, we have to think a little bit wider. The next slide, please. So in the publication by Hyacinth et al. 2010, they actually provide a number of proposed mechanisms to explain the occurrence of undernutrition. And if you look at the top 3 points there, increased red cell turnover, protein hypermetabolism, and high cardiac demand and expenditure, it directly speaks to the anemia of sickle cell anemia. And that is why, it's important that when we think about sickle cell, yes, we think about the undernutrition, yes, we think about the nutritional deficiencies, but we have to understand the anemia aspect of sickle cell, because those 3 mechanisms there are closely and directly resulting from the anemia aspect of the condition. In addition, the literature also identifies the presence of interleukin-6, which is a cytokinin that's released in the presence of infection in particular, which has been associated with appetite suppression in sickle cell patients. And in addition, the current existing literature also identifies key nutrient deficiencies, in particular zinc, selenium, vitamins A, C, and E, which are key antioxidants, vitamin D, B vitamins, in particular folic acid, omega-3, and iron. The next slide, please. And so again, you know, we know now that nutrition isn't a part of the standard management of sickle cell, and as a result of that, the approach that is taken to nutrition is very much a general approach. It's more focused on healthy eating than looking at the specific nutritional problems affecting sickle cell patients. We have, as I've experienced in the UK, very little dietetic involvement, and we have nutrition that isn't forming part of the standard clinical management, which is actually being called for in the publication by Hyacinth et al. 2010, that nutrition can actually form a really important management opportunity as part of the standard clinical care that's available to sickle cell patients. And so we also find that there's very low levels of referral rates of sickle cell patients with nutritional problems to dietitians. And when it comes to nutritional assessment and patients requiring supplementation, secondary to perhaps having undernutrition, that process doesn't happen. So looking to the future, what we are looking for, and certainly through my research, is to look at the development of sickle cell specific nutritional standards, and I'm really glad to say that I've been invited to write the first ever national nutrition standards, which is available through the Sickle Cell Society in the UK. As part of my research, I'm actually in the process of developing a nutrition management framework to inform policy and practice development in the area of nutrition. In addition, I'm looking to develop a nutrition management toolkit available to providers as well as patients and partners, and also looking at specific nutritional resources. Cumulatively, all of this working towards supporting the integration of nutrition into sickle cell healthcare provision. The next slide, please. So that brings us nicely on to part 2, which is looking a little bit more about taking a new perspective to how we understand nutrition in sickle cell, and a little bit about my research approach. The next slide, please. I can't speak about nutrition in sickle cell without calling out that it is a health inequality, and certainly in the UK, it is a health inequality, and I can imagine that that is a similar situation in the US. And why do I say that? Because we have 60 years, over 60 years worth of existing scientific literature looking at the role of nutrition, but none of that literature has been translated into meaningful evidence base that can be used to support and inform policy and practice development. And as a consequence of that, what we find is that we have institutional oppression, which means that there is poor nutrition services available to sickle cell patients, and there's limited access for sickle cell patients to existing nutritional services. Furthermore, what we have is disempowerment, and this is disempowerment that affects both sickle cell patients, providers, and health planners. The impact of that is poor nutrition knowledge and awareness, poor nutritional resources, and poor nutrition service provision available to sickle cell patients. The next slide, please. So nutrition not being part of the standard management in sickle, for me, is directly resulting from a power imbalance that exists between the medical management of sickle cell and the nutrition management of sickle cell. Even though there is clear rationale for nutrition to be considered a viable management option, and it is a viable option for the reason that it is a public health problem. We have high readmission rates of sickle cell patients to hospital, having high cost effects and cost burdens, as well as high health burdens for the patients themselves. We find that nutrition is overlooked as a management option, and as I said before, coming directly as a result of the lack of translation of existing research. The next slide, please. So currently, nutrition service provision, certainly here in the UK, and I would imagine again in the US, what we find is poor nutrition knowledge of sickle cell. I constantly have people saying to me that I've never heard nutrition and sickle cell being spoken about in the same conversation. And so we find nutrition being underused, under-recognized, and underdeveloped in sickle cell. We have poor or very limited nutritional guidelines available, and we have very limited nutritional specific to sickle cell resources available in sickle cell disease. The next slide, please. And this brings me really onto a really important point, in that we have to utilize the power of the sickle cell patient voice to influence change. When I recently spoke at the conference in London, that I actually dedicated a whole section to that, because we have to empower our patients in particular to be asking for, what they need, and specifically in the area of nutrition management. And I've included in this slide a number of comments that I have collated as part of my research project, and I'll just read a few of them. So the first one, nutrition is fundamental. This is coming from the sickle cell patients as part of my research project. It's a massive part of mental health. Nutrition is not part of sickle cell. Nutrition is never mentioned. I have to do my own private research, and this was actually across service users, patients, as well as providers, and nutrition is overlooked. And so this is something I really want to encourage the sickle patients in the audience, that you take up this and that you ask for what you need, because until you do that, then it's nothing's or very little is going to change. So I dare you, if you're in the audience today, to take up this challenge and open your mouth, use your power, use your voice to ask for what you need, and get nutrition recognized as a viable option within your care. The next slide, please. So for those reasons, it is important that we actually need to take a new perspective in the way that we understand nutrition in sickle cell. And as I've already mentioned, we have this overarching problem of a lack of integration of nutrition into sickle cell healthcare provision. And the impact of that is that many of our sickle cell patients actually experience poor health and well-being outcomes. And so in regards to my research, the overarching knowledge gap that I've identified is that currently there is no framework available to support the integration of nutrition into sickle cell healthcare provision. And for this reason, the primary output of my research project is to develop a sickle cell nutrition health education framework that can inform policy and practice development to support the integration of nutrition into sickle cell healthcare provision. The next slide, please. So the next two slides are just abstracts that I have submitted that's been published. And the first one is the title, A Qualitative Study to Understand the Optimum Nutrition Needs of Sickle Cell Patients and the Influencing Socio-Ecological Factors. And what was clear, the message that came through here, was this overarching lack of knowledge about nutrition, both for the patients and the providers. And the consequence to sickle cell patients has been that there has been this late diagnosis of nutritional problems in sickle cell patients, problems that could have been diagnosed so much earlier for a sickle cell patient, but because nutrition is in part and parcel of the standard management, this has been delayed for patients. And the second one I share in the abstract is one that I wasn't aware of. It is the idea of that with children with sickle cell, there's actually depression, within children who have sickle cell disease. And this was finding from one of the clinic dietitians, pediatric dietitians, who was part of my research project. And you can only imagine if a child, is experiencing depression. We know that as adults, if we have depression, the impact that can have on, just overall mental health, well-being, but also in nutrition, and how much more for children. The next slide, please. So this is the second abstract, which is a qualitative study to understand the barriers to integrating nutrition into sickle cell healthcare provision. And again, that message was echoed in that the lack of knowledge of nutrition being a really key theme coming through as a barrier, nutrition being overlooked, a key barrier, and then the need for nutrition management to be part of the standard care available to sickle cell patients. The next slide, please. So that brings us nicely on to part 3, which is sort of getting into the nitty-gritty a little bit, and this is exploring the nutritional implications, problems, and management in sickle cell. The next slide, please. So we know now that sickle cell is a complex genetic condition, and if we overlook nutrition or neglect nutrition as part of the standard management, there are serious implications associated with that. And I've identified 3 key implications, and that is a compromised health. And we know from the first slide that I've shared with you that we have within sickle cell, because of the clinical features, we have increased risk of morbidity and mortality, and therefore also associated poor quality of health. We have increased financial burden associated with the costly management of the medical modalities or the treatment modalities that we use within sickle cell, but we also have poor quality of care in that we have an inequality in sickle cell patients accessing nutritional services. And the next part of this slide is literally an article that I'd written that was published in 2015 with that title of Nutrition in Sickle Cell Being a Multifactorial Phenomenon. And through this article, I identify that nutrition in sickle cell is not just about the nutritional aspects. It is about us factoring in the medical considerations. It is about us looking at the psychosocial impact factors that impact sickle patients, but also the effect of the wider determinants of health that many sickle cell patients are exposed to. And so when we're looking at nutrition, we have to be looking at nutrition through that lens of it being multifactorial and the complexity of sickle cell as a condition. The next slide, please. The nutritional consideration. The next slide, please. So when we're looking at nutrition in sickle cell as well, is that we have to understand it is a problem across the life course. It is not just the pediatrics or children, because more or less, if you are going to be providing nutrition, it is usually within the pediatric sort of care provision. But nutritional problems exist for sickle cell patients across the life course. So within pediatrics, yes, we know delayed growth, there's stunting, there's wasting, and there's also disease-related malnutrition. And I use the term disease-related malnutrition because if you look at existing scientific literature, that isn't actually a term currently used. It's just referred to as undernutrition. But I prefer disease-related malnutrition because I want people to understand that the malnutrition in sickle cell is directly related to the disease itself. And so I've written a paper actually to speak around the disease-related malnutrition as part of sickle cell. Adolescence, we know as well, is a really key area. We look at the literature, and that is actually where most of the nutritional problems come in for sickle cell patients. And we know also in this group, we have the delayed puberty, we have infection risk, we have nutrient deficiencies, as well as the disease-related malnutrition as a consequence of, particularly in this group, patients not choosing well, not eating well, and that can have a knock-on effect on the nutritional status. And then moving on to adults and aging, we have our sickle cell patients, because of treatment, living a lot longer. So now we have patients suffering, having to manage the symptoms of sickle cell, but also, of aging. And so we have to pay attention to how we can better serve these patients. And in addition to that, our pregnant ladies, what are we doing to support the pregnancy, outcomes for sickle cell patients? And what are we doing to support the pregnant mom, with sickle cell? And so it's really important that we consider nutrition, not just in the pediatric population, but across the life course in sickle cell. The next slide, please. So this slide is looking at factors increasing the nutritional requirements in sickle cell patients. And again, it speaks to the complex nature of sickle cell. And because of that, the nutritional needs in sickle cell patients are quite complex. We have, because of the fact that the anemia, and the hemolytic anemia, the chronic hemolysis, the rapid breakdown of red blood cells, and the need to constantly make new red blood cells, we have the waste of nutritional resources due to this ineffective red cell production. We also, because of the pathophysiology of sickle cell, it's a blood disorder, and so therefore it affects all the organ systems, as well as, you know, all the organ and the systems of the body. And so that's something that we have to consider as well. And then we have inflammation, which sometimes in sickle cell is overlooked. But inflammation is an important factor to highlight, because when we have chronic inflammation like we have in sickle cell, there's the overproduction of free radicals, which results in the tissue damage, which we already find because of the ongoing crisis that happens for sickle cell patients, and bearing in mind that conditions or like iron overload infections can also result in the inflammation that we find in sickle cell patients. And in addition to all of that, there's a number of clinical manifestations. So for sickle patients, we said earlier on that we have an increased risk of immunodeficiency within sickle cell patients. So there's an increased risk of infection, particularly the streptococcal infection. We can have neutropenia in some patients, which can result from, depending on their dosage of the hydroxyurea treatment. I mentioned the chronic inflammation. There's patients at risk of stroke, and then they can also have longer term problems like renal failure, liver failure, patients requiring liver transplantation. And I had one of those patients in the UK. They can have cardiac failure as a consequence of cardiac iron overload, and also chronic lung disease, particularly the pulmonary hypertension that many patients suffer from. The next slide, please. So indications and management of nutrition in sickle cell, again, you know, there are a number of indications, you know, for calling on the nutritional management of sickle cell patients. The first one I put on there is malnutrition, and I could have put there the disease-related malnutrition. There's patients with ongoing poor appetite and weight loss, and we've seen that interleukin-6 has a role to play with appetite suppression in sickle cell patients. We have patients that may, over the course of their time, require oral nutritional supplementation, enteral or parenteral nutritional support, and therefore may require more specialist dietetic input. We have patients with leg ulcers, so they need support and guidance around wound healing. We have patients with stroke. We have patients needing liver transplant, renal failure, cholecystectomies. You know, even in younger patients, I've just recently seen a young 6-year-old, you know, that has cholelithiasis as an ongoing chronic problem. And then we have obviously patients with ongoing infection risk, and also other gastrointestinal side effects as a consequence of the treatment modality. So there's a number of indications, you know, calling on nutrition to be part of the standard management for sickle cell patients. And then on the management side, as a dietitian, we would be looking at the macronutrient side. We'd be looking at energy, factoring in, you know, the disease stress factors. We'd be looking at protein requirements, fluid, fiber, constipation being a significant problem as well because of a side effect of the analgesia that sickle patients, you know, have to use to manage their pain. And then also on the micronutrient side, we've already seen the micronutrient deficiencies, zinc, folic acid, omega-3, selenium, the antioxidants, vitamins A, C, and E, vitamin D, calcium, and then the B vitamins. The next slide, please. And so what are the main disease-related factors underpinning the nutritional problems in sickle cell? And this comes from the existing scientific literature. So you will find that they have high resting energy expenditure. And this, again, is directly correlated to the hemolytic and the anemia aspect of sickle cell. They have poor immunity. We've said that already. They have high protein turnovers. Many patients, particularly those with homozygous disease, have low BMI. They can have poor exercise tolerance. There's appetite suppression as a consequence of the pain, but also as a consequence of the effects of interleukin-6. And what my research project is looking at is the gap, which is the socio-ecological factors influencing nutrition in sickle cell patients. The next slide, please. So looking at the common disease-related and the socio-ecological factors affecting nutrition in sickle cell. So the known disease-related factors are things like dehydration. And, you know, for sickle patients, this is something that's drummed in, you know, across the life course: drink more fluid, drink more fluid. And it saddens me that we can't expand that, you know, to look at the other aspects of nutrition, not just the dehydration or the fluid aspects. We spoke about the impaired immune functioning. We spoke about the inflammation. We spoke about the chronic anemia and fatigue associated with the fact that sickle cell is an example of a hemolytic anemia. We spoke about the constipation, and this is, as I said, it's a consequence of the medication that sickle patients have to take, the pain relief that they have to take, and then also the fact that there's low BMI. And I've put under each of those points sort of the nutritional sort of management options that can be considered to overcome these common nutritional problems. And then looking at the socio-ecological factors, which is, as I said, the key part of my research. So this is the unknown aspects looking at the nutrition needs of sickle cell patients. And for me, this is all about looking at what are those personal factors, the interpersonal factors, the institutional factors, the community and policy level factors that actually have a role to play in the nutrition needs of sickle cell patients, and that actually collectively, you know, form barriers to integrating nutrition into sickle cell healthcare provision. And I'm really excited to hopefully soon be able to give you a little bit more insight into my findings on this particular part of my research project. The next slide, please. So nutritional monitoring and raising awareness, these are things that you can do as part of the management already. And this is looking at red flags. You know, there's always, when you're looking, you know, clinicians always looking for red flags. Why not extend that to nutrition? And that is simple things like, you know, have patients lost weight unintentionally, which we know is a high risk in sickle cell disease. You know, have they had prolonged poor appetite, prolonged intake? Have they gained weight? Because that is what we're finding now. We've got going the other way. We have more patients sort of being diagnosed as being overweight and obese. So what are the red flags that we can identify as part of the role that we're already, you know, playing? You know, in terms of regular monitoring, using every opportunity that you have when you come into contact with a sickle cell patient to ask, you know, about the nutrition. We saw the comment that was made, nutrition is never mentioned. Why not start asking the patient about nutrition when you come into contact with them? At every appointment is what I'm asking for, or at least consideration. And at least if you can't do that at every appointment, then at least at every annual review that you have contact with the sickle patient. The next slide, please. So we have to take a holistic approach when we're looking at nutrition in sickle cell, and this is what the slide is about. And the Eat Well guide is actually the guide that we use in the UK. I know that you guys use the pyramid, but you know, this information is general information. What I'm looking again as part of my research is actually to tailor the Eat Well guide to the specific nutritional problems that's been identified associated with the nutritional needs of sickle cell patients. So that is something that I'm looking to do as well. And so we have to take a balanced approach, you know, when we're thinking about nutrition. And I've used the word reframing nutrition because we have to take a different and a new perspective to the way that we look and understand nutrition in sickle cell, away from just the undernutrition, away from just the nutritional deficiencies, and look at the other factors. You know, so as part of my research, I'm actually looking to redefine optimum nutrition to include the nutrition factors, the medical factors, the socio-ecological factors, as well as the psychosocial and the socio-ecological factors or socioeconomic factors that actually have a role to play when it comes to the nutrition needs of sickle cell patients. We also have to factor in the distinctive diet and lifestyle preferences of our patients. Many patients follow a vegetarian diet, and many more patients are following a vegan diet. So when we're looking at nutrition, we have to bring that into consideration as well. And many patients are asking more and more questions around the alternative approaches, the plant-based supplements, as well as herbs and homeopathics. And I will add here, because I know I'm going to get questions around this, this isn't my area of expertise, but I know that they're just from sort of having scoured the research, there's current research looking at sort of, you know, doing more research, looking at the efficacy, but also at the safe dosages for particularly plant-based supplements as well as herbs and the homeopathics. The next slide, please. So taking responsibility, you know, this is all part of us looking at thinking about a call to action. What are our responsibilities? Starting with what's the patient's responsibility? You need to understand your condition. Many sickle patients don't actually know the condition. They don't even know what their baseline hemoglobin levels are. And that is something that I encourage sickle cell patients to ask their providers, you know, what is my standard hemoglobin level for, you know, as a standard minimum? You have to understand your condition. You need to be able to recognize and know the nutritional consequences of your condition. You need to understand the importance of the early recognition of your nutritional symptoms and consequences. You need to understand your nutritional risk factors, but you also need to know the main nutritional triggers, particularly those triggers that can actually result in a sickle cell crisis. And then for a provider, your responsibility, you need to know the condition. I can't speak about nutrition in sickle cell without first speaking about the condition. I had to take the time to understand the pathophysiology of sickle cell for me to be able to speak on nutrition in sickle cell disease. You need to recognize the nutritional risk of sickle cell patients, and therefore you have to screen your patients for the nutritional risk. And in the UK, we use the MUST, the Malnutrition Universal Screening Tool. I'm not sure what you use in the US, if you do use any tool at all. And then once you've done that, you have to assess the nutritional risk. You have to ask those questions. You have to ask, have you lost weight? What is your appetite? You know, if patients having ongoing infection risk, you know what, there might be a really clear nutritional sort of underpinning factor for that. Ask the question, take the time to do that, then refer these patients for nutritional risk management or assessment. Raise awareness amongst your colleagues, and also treat every individual sickle patient as an individual, because we know from the medical side that sickle patients present very individually, and it's the same thing for nutrition in sickle cell. You can't, you know, treat every sickle cell patient with the same sort of approach. And so, yeah, every patient an individual case. The next slide, please. So a call to action. I started off with speaking about a call to action, and so this is the final part of the presentation. And for me, I'm really keen on empowering our patients to take charge and to self-manage their condition, not only in terms of being aware of their condition and the nutritional needs, not only in terms of their knowledge and understanding, but also in terms of factors like, you know, thinking about how important their health is to them, how motivated they are to change, you know, what is their self-belief about their condition and their ability to change? What are their confidence levels in terms of changing? What are the self-awareness and what things they already are doing or can do to improve on their outcomes? And I've actually designed what I call the Assess Health Questionnaire, to help me facilitate this questioning within my patients. The next slide, please. So my call to action is, you know, what I've expressed in the beginning. I've written several articles on the subject, a number of publications. I've written the first ever National Nutrition Standards. I'm doing a self-funded doctorate, you know, in order for me to be able to influence policy and practice change. I put on the first ever conference on nutrition in sickle cell. And so I'm doing this talk today, and I'm doing several other things within my capability to try and really raise awareness and move forward, you know, this integration of nutrition into sickle cell healthcare provision. But you also have a role to play. The next slide, please. So what are our call to action. The next steps, we need to take a new perspective to the way that we understand nutrition in sickle cell. We need to mandate nutrition as a priority in terms of the management of sickle cell. We need to adopt nutrition as a management option. And here I will add that nutrition does not and will never replace the medical management, but nutrition becomes an adjunct, an add-on to actually help support the medical management of sickle cell disease. We have to listen to and engage the sickle cell patient voice to influence change, and we have to apply the national nutrition standards. This was in the context of the conference, but whatever standards that you already have in the US, you have to actually not just have standards, you know, for show, but actually start applying that, you know, into policy and practice development within your services that you provide. And so, yes, calling on policy and practice level development, we have to have the involvement of key strategic stakeholders, sickle cell associations within the US, ASH, ADA, CDC, and I'm so thankful to CDC and Tracking California for inviting me to speak today. Any third sector or voluntary organizations within the US, both health and social care, we all have a role to play to actually move forward this idea of integrating nutrition into sickle cell healthcare provision. The next slide, please. And so I want to say thank you so much to every one of you that have, joined the webinar today. And I want to leave you with a quote that I wrote for a book chapter that I wrote recently. And this has sort of been my experience in sickle cell in the area of, improving the nutrition landscape in sickle cell. I've had many, many, many doors closed to me, but every closed door brings you closer to your destiny. And I can say that today that I am in the position to bring this talk because several doors have been closed, but many doors are now opening to me. So today I'm grateful for those closed doors, but even more thankful for the open doors. And so I want to acknowledge Tracking California and the CDC for this opportunity. But my ultimate quote I love to leave people with, and again, this just describes my journey, my 7-year journey, you know, in sickle cell and in the area of nutrition in sickle cell. And this speaks to the call to action. Do not go where the path may lead. Go instead where there is no path, and leave a trail. So I want to encourage everyone on the call today. What is the trail that you are going to leave as a consequence of having attended this webinar? Thank you. Thank you.
Wow, Claudine, thank you so much. That was so informative, and I definitely feel inspired. I don't know about others on the call. At this time, we'll transition into the next portion at taking our questions. As a reminder, we're taking questions through the chat box or question function on the control panel feature of your webinar. And so I'll kind of get started with looking now to see. I think we did have a couple questions come through.
Mm-hmm.
Okay. So the first one looks like, is sickle cell disease and the spectrum of its complications taught in RD studies?
No, because nutrition in sickle cell isn't recognized as a problem. And that has been the aim of my research project, is actually to draw awareness to the whole idea of nutrition in sickle cell needing to be part and parcel of that. And the framework that I mentioned that I am developing as a consequence, as an output of my research project, to be available to develop actually further webinars and training that can be incorporated into RD training that can be taught, you know, undergraduate and also postgraduate. So, and what I will say to that as well is not only the RDs, but it should be everybody that provides a service to sickle cell. There will be degrees of information, obviously, depending on, you know, if you're a dietitian, obviously you will need a little bit more specific dietetic information. But I want to say at this point that the information should be available to everybody. And this is partly why I didn't just want to do a research project where we provide stats, but I wanted to provide a tangible outcome that can actually inform education around the topic of nutrition in sickle cell moving forward. Great question, thank you.
Wonderful. Okay, our next question says, in the U.S., many patients live in communities with higher risk of food insecurity. This compounds the challenges that families face in meeting their dietary and nutritional needs. Is this also the case in the UK, or is there some sort of income support systems you have that are more robust there?
So it's very similar for many of our sickle cell patients in the UK, food insecurity being a major problem. And that is one of the reasons why I've gone down this perspective to look at the socio-ecological factors around the nutritional needs of sickle cell patients, because even though food insecurity, you know, is looking at the food, but it's also looking at the socioeconomic elements that come to play when we're thinking about the nutritional needs of sickle cell patients. We do have a social support system in the UK where patients can access, you know, obviously depending on who the patient is, that they will receive some sort of financial support, but that financial support has to cover so many other things that in the end, they still end up with very little money available, you know, to buy food. But what I want to highlight, and that's a key part of my focus for the research, is to actually identify that it's not just the food aspect, you know, it's the personal factors, it's the interpersonal factors, the institutional, the community level, and the policy level factors. All of those factors cumulatively influence on the nutrition risks and needs of sickle cell patients. And so it is a major problem, definitely in the UK. But I think going forward, when we planning services for sickle cell patients, that we think wider than undernutrition and wider than nutritional deficiencies, and we actually look at, you know, the food insecurity in the context of the personal, interpersonal, institutional, community, and policy level factors. I hope that answers the question.
Wonderful. Oh, there's quite a few more coming through. Let's see. So someone says, what a wonderful talk. Thank you so much. They might have missed it, but were there any labs you recommended adding to routine clinical visits?
I didn't hear that last part of the question, Niani.
They were asking if there were any labs that you would recommend adding to routine clinic visits. So I'm assuming they just mean any testing that you would suggest that they get done when they have a visit to their clinic.
That is a very good question. I think what I would add now is certainly in terms of the nutritional sort of deficiencies, that would be something that will be a helpful lab to add, because I know it's not routinely done. It's mostly in terms of ferritin and transferritin in terms of iron overloading. But I would hopefully, when we have money and when nutrition is sort of incorporated into the standard clinical management of sickle patients, that we would have a baseline of the key nutritional, my brain's gone, nutrients, you know, so that we have a baseline of where sickle cell patients are. So that would be something that I would definitely recommend adding onto, because routinely, if you look at the bloods for sickle patients, you will have the U's and E's, and obviously they would look at the LFTs side of things, but they wouldn't be looking necessarily wider than, they would look at folate, they would look at B12, they would look at the iron side, but they wouldn't be looking at things like the zinc and that side of things. And I would definitely want that as a standard added to it as well.
Okay, great. Our next questions, and so many more thank yous coming in. Someone asked, have your nutritional standards been published yet? And if so, where can we find them?
Yes, they have been published. They were published as part of the National Clinical Standards for Sickle Patients. It is available on the Sickle Cell Society website. So if you Googled, you search bar Sickle Cell Society UK, the national clinical standards will come up. It was published in 2018, and specifically page 76 of the standards is where you will find the national nutrition standards. I have also actually written an article about the standards, and I would be happy, Niani, to share the link to that article with you, because the sad thing is we have these standards as part of national clinical standards, but nobody knows about them. And that's why I've had to write another article about it, to drive, to raise awareness about it. And so, yeah, I'll definitely share that link with you that you can make available to the attendees.
Okay, that sounds great. And I will have on the next slide, I believe, some information about getting in touch with us. I think we have time for just a few more questions.
Yeah.
Let's see. More thanks being given. Someone says that they have sickle cell in the UK and they're also an advocate. Thank you so much for your work. It's truly a neglected area. And they recently wrote looks like a cookbook for SCD warriors to help them with recipes. So I think they're asking to get in touch with you. So I will link the two of you. And then they said, as it being a neglected section, and for parents with kids living with SCD, because sometimes they as adults and their food habits are formed, is there anything that you're looking at in this type of realm as well? So I think they're just asking about recipes and if this is something that you're looking into.
Yeah, so the way that I see my role in this, because somebody has to coordinate all of this, and I know that we have amazing qualified dietitians all over the US and the UK and in other countries. So what I'm hoping to do is to, once this is up and running, to liaise with either the associations, the dietetic associations, that we can actually draw on the experts, the people that are already working in the field, and use my research, my findings from the research to tailor what they're doing with the sickle cell patients. So in regards to recipes and that side of things, no, I haven't done that, because there's so many aspects, because it's such a new area. There's so many things, and as the only dietitian, doing this kind of research at the moment, it's really difficult for me to do everything. And so I will be turning to the qualified RDs, nutritionists available, so that collectively we can sort of put things together. But for now, my aim is, with the work that I'm doing and with my research findings, and certainly the framework that I will be that I am developing, is to work towards nutrition in sickle being recognized as a viable management option. And once we've got that, and that's why we need policy and practice. All of what I'm doing is about influencing policy and practice level, because if we don't have policy and practice level, nothing on the ground is going to change. And that's why I chose this, aspect to my research project, because we've got over 60 years worth of research, but nothing has changed. And so if we're going to change the landscape of nutrition, we have to go towards policy and practice level. We have to get the providers, the partners, all of the stakeholders recognizing that nutrition needs to be part of the standard management. And once we've got agreement on that level, policy and practice level, then we will filter down to how that can play out on the ground. And that is sort of the vision that I have for moving this forward.
Wonderful. I think there's about 3 more questions. Someone says, great presentation, Claudine. What potential challenges, if any, do you see in reconciling the elevated protein synthesis needs or cellular turnover of SCD with a desire for more plant-based food nutrition? And can this be done cost effectively?
That is a really good question. That's a loaded question. And what I will say to that is precisely why, for me, if we're going to be looking at nutrition in sickle cell, we have to open it up. We have to take a comprehensive view. We have to look at the other influencing factors for that particular person, because we know that if we just look at food, you know, in terms of protein and certainly in terms of plant-based protein, you know, but we don't look at what else is happening for that patient. Where in, you know, what's the family setup? What's the income setup? You know, how empowered, how activated is the person or the family? You know, what other resources in terms of finances do they have to be able to provide, you know, for the recommendations that you will make? And that, excellent question. That is the precise reason why that when now I, you know, think about nutrition and in any aspect, you know, not just on the protein hypermetabolism, but in any aspect, nutritional problem with sickle cell, I'm going to be asking, in addition to the food element, I'm going to be asking what else is going on for that patient. What are the other personal, interpersonal, institutional, community and policy level factors, psychosocial, wider determinants of health that we need to consider and bring into the conversation to actually work together to help us achieve and improve the health and well-being outcomes for sickle cell patients. So I hope that answers the question, because we do need to reframe how we think about sickle cell, because if we keep doing it the way that it's been done in the past, thinking just about food, then we are not going to achieve the outcomes that we need for our patients.
Great, thank you. And then it looks like this is our final one. You answered the previous. As a sickle cell counselor, someone is saying, what are some of the questions regarding nutrition that you suggest be discussed when completing assessments and with children and adults that have sickle cell disease? So you answered something similar, but I think, you know, they're asking, are there specific questions that they could or should be asking in regarding nutrition?
You know, it's amazing, and that's a really good question. So even if you start with, tell me a little about your current eating habits, even starting a conversation like that, you know, how is your eating been today or over the last week or over the last month? Even just starting with that conversation and allowing that patient to talk, you will be amazed how much information you will get, because what we tend to do as providers, we tend to provide the information and not provide enough time for the patients to actually, they will tell you what you need to know if you start with a question but give them the time. But we're not asking the question, even that simple question of, tell me about your diet, tell me about what you're eating at the moment, you know, tell me about a challenge in terms of your food and your dietary intakes at the moment. So that would be my advice, you know, start with that simple question, allow the patient time to talk, because anything that's a challenge to them is going to come out if you ask the right question and you allow them the opportunity to speak about it.
Wonderful, Claudine. Thank you so much for taking the time to answer all of these questions and for such an insightful presentation that is both empowering as well. I want to make sure that at this time I allow any of the hosts or other panelists to ask a question or if they have any final comments.
Thank you.
Hi, this is Susan Poliukonis again. I just really wanted to echo you know, what Niani's been saying, that she's seeing in the chat box, just how incredibly helpful this is, and I think a shift in thinking for a lot of us about this really important topic and how we might be able to make some movement on it here. I did have one question that pertains to that, and that was whether there are models that we can look to in other diseases who have done a better job, in incorporating this into the care management system. I mean, we hear often with a lot of the questions that we ask about health equity and health disparities, we look to other genetic diseases like cystic fibrosis, like hemophilia, and look at the systems that they've set up. Have you encountered a model such as that where nutrition really has been effectively incorporated?
To be honest, I haven't looked at that specifically, because at the root of the problem for me, and sort of the getting the message out, was actually getting people to listen in the first instance. Because as I've mentioned, nutrition in sickle isn't a thing. It isn't an existing thing. It's a thing that I'm calling to. Now that I know that people are interested, you know, and specifically when I thought about what is the best output for my for the doctorate, that is why I have developed this framework, because I am proposing that the framework that I put together is actually a framework that can be used to influence policy and practice change, that will highlight what are the unique problems, you know, barriers that affects the sickle cell community that we need to factor in when we're thinking about setting up service. So certainly the framework that I am putting together as the output of my research is looking to do that. So yeah, I haven't necessarily looked outside, you know, to cystic fibrosis and hemophilia as such, because it was me fighting to get the message of nutrition for people to listen, if that makes sense.
Yeah.
And now that people are starting to listen, I'm hoping that, you know, even your question now, when I go back to my framework, I can now be looking at what sort of modifications can be made so that we can use that as a model that can be used going forward. So that's a great question. But it's really encouraging as well, you know, to hear that people are now opening. And like you said, it is the paradigm shift. It is the paradigm shift on a level that, you know, as part of my thesis, you know, there's nothing out there. There's nothing else out there speaking to this. And so yeah. So for me, you know, that was the key reason why I have gone with. I am actually developing what I call a multi-system management strategy to support the integration of nutrition in sickle cell. That is what I'm producing as part of my research.
Thank you so much. And really, I want to just say thank you so much for your passion about this. It really comes through. And I think this is how change happens, is, you know, having someone who really makes it their mission to lead the way. So thank you very much for taking on that role with us.
You're very, very welcome. I've wanted to walk away, but you know, this is like you said, it's a passion, and you know, it's even in terms of the doctorate, you know, self-funding, it's been really challenging. But I absolutely believe it. I absolutely believe in the cause. And if it will help one patient, then I will continue doing what I'm doing. So I'm really, really thankful to you, you know, for reaching out to me and for giving me the opportunity to speak. And as I said, you know, I hope that as a consequence of this one talk, that, you know, that call to action, that people will go away and consider how and what else they can do to actually take this forward. And I know in the UK, I've been approached by a local mayor within the area that I live to actually go and do some education in the schools. So I'm doing that project as well, because whatever opportunity we have to spread the word, you know, I'm just holding and grabbing onto that, because we need more people to hear about it, and we need more people, you know, to speak and share and to draw attention to the fact that we have to start thinking about how we can integrate nutrition into sickle cell healthcare provision.
Thanks so much.
You're very welcome.
Okay, so there's been several things in this chat. So much thanks and gratitude being expressed, Claudine. So I will make sure you get those messages. For if whatever reason, sure, if that your questions weren't answered or you need to get in touch with us or Claudine, please look on your screen, and you can reach us at trackingcalifornia.org, casicklecell.org. We're also very active on our Facebook page. As Claudine mentioned, she'll share some resource links with me, and I will make sure that I post it to our Facebook today. You can also always email info@trackingcalifornia.org to get in touch with us or Claudine. And so with that, I will wrap it up and say thank you so much to everyone that participated, for your attendance and for joining us today. Special thanks to Claudine for such a beautiful and insightful and empowering presentation. We appreciate you all being here, and we will see you next time.
Thank you so much. Take care.
Thanks. Bye, everybody.
Bye. Bye-bye.
Thanks.